I just feel like there's certain
hollowness or something.
Hollowness is the word I would.
Okay.
You do see it.
Yes, of course. Yeah. So some people actually like this, but I totally understand. It's a little bit extreme, especially on the side. So because of it, your contour kind of goes in a little bit, and actually, in some ways, almost accentuates the jowl.
Exactly.
Yeah. I'm just going to add a little bit of fat back into this area. Okay. I probably won't put it truly in the anatomical space, which is where your buccal fat pad originally came out, but I will put it in the deeper space, so it stays where it's supposed to stay. There's lots of different ways to access this. You can go this way, you can go this way, you can go from here, you can go from the corner of the mouth. Today, just for ease of access, because of the positioning, I'm going to go from the corner of the mouth. So the important thing to know is you're in the right space. You don't necessarily want to be down to the muscles. There's some facial nerves there you can be potentially in the way of. But in some instances, you actually do want to graft that deep. In this particular case, I'm going to graft in the subcutaneous space, sort of in a SMAS layer. I put 5 cc's here, and you can see it's actually pretty well corrected. That looks actually good, which means I should probably put a little bit more.